Welcome to episode 22. Today on Beyond the Thyroid, we are going to go over just what TSH tells us, particularly when it's low. So I know I spend a lot of energy talking about how the TSH test isn't the be-all and end-all of thyroid testing and how other hormone tests are essential for a full picture of thyroid health. Now, that is not to say that the thyroid TSH test does not have value. Actually, it tells us some pretty important things. Generally, an abnormal TSH means something is wrong somewhere, and the problems that it points to can be an indicator of some serious medical conditions, side effects, and consequences. There are some thyroid fixing gurus out there recommend taking so much thyroid hormone, particularly T3 and the undetectable T2 hormone metabolite, that it pushes your TSH down, not just to the lower end of the normal range, but so low that the test can't even detect it anymore on purpose. But is that really a good idea? So I'm Dr. Dana Gibbs, and today we're going to explore what it really means to have low TSH and why some people push it too low on purpose and what the risks are. So let's get going and find out what's the matter with having low TSH. You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. I have a really exciting announcement. Because up to 50% of people who suffer symptoms of low thyroid, the low energy, the weight gain, the gut problems, the thin hair, dry skin, will be told by multiple providers that there's nothing wrong with their thyroid before they get a diagnosis because they have normal TSH, I am going to build a new offering in my practice that I'm going to call the Thyroid Checkup. Because this circumstance is so discouraging and frustrating when you know you don't feel like your normal self. I know because it happened to me and hundreds of my clients. So if that's you, what you need is access to advanced thyroid lab testing and analysis by an experienced and qualified specialist who goes beyond guidelines-based thyroid care to help you finally know where you actually stand in regards to your thyroid. This will be a small group program with direct access to me, where I'll help each person get answers about their thyroid status and next steps to recover their energy and vitality. So if you want more info about this, go to www.danagibbsmd.com/checkup to get the earliest notification when I open this program. It's going to be soon, so don't wait. Hello, friend, and welcome back to the podcast. And if you are new here, I am so happy to have you here. Today, we're talking about what it means if you have low TSH, what situations or diseases can cause that, and what, if anything, needs to be done about it. We'll also talk about why some people push their TSH too low on purpose and what the risks are if you're doing that. So before we go any further, I want to make sure that you understand how TSH works, especially if this is new to you or if you don't have a science background. So those of you who already know what this is, bear with me because I really want to explain it in a way that I think almost everybody can understand. So TSH, or thyroid stimulating hormone, is a chemical made by a part of your brain called the pituitary gland. And the job of TSH is to tell your thyroid gland how much thyroid hormone it should make. So I'm going to use an analogy. Think of your body and your thyroid hormone system like a house that has central heat. So your brain, your pituitary gland, is the thermostat, and it's constantly monitoring the temperature in the house, which is the temperature is your body's thyroid hormone level and activity. So your thyroid gland is the central heating system, which produces the heat that warms up the house, and that's your properly balanced thyroid hormone. TSH is the signal that the thermostat sends to turn the heater's elements on when it goes higher or off when it goes lower, when it detects that the temperature is not exactly right. So I'm going to start by telling you how things work when everything is working just fine. So if the temperature in the house, the level of thyroid hormone, drops too low, then the thermostat, the brain and the pituitary gland, senses this and sends a stronger signal in the form of higher TSH to tell the heater, the thyroid gland, to work harder and pump out more hormone. If the temperature is just right, then the thermostat is only sending a small signal, a mid-range TSH, to maintain a steady warmth in the house. If the temperature, the thyroid hormone, is too high, then the thermostat turns the heater down or even off by sending a very low signal, low TSH. So it is super cold in Texas today, probably the coldest we're going to get all year at about 15 degrees. So this is really on my mind right now, and this analogy makes a lot of sense to me. And that's how it works when everything is normal. The TSH made by the pituitary gland circulates in your bloodstream, goes to the thyroid gland to signal it to put out more or less thyroid hormone. And when TSH is high, it's giving more signal. And when TSH is low, it's giving less signal. That signal then goes to your thyroid gland to release the thyroid hormone, which goes to your body cells to do all the things that thyroid hormone does. Some of that thyroid hormone is then going back to your brain to signal when there's enough, too much or not enough thyroid hormone, to control how much TSH is going to be released. So that's when things are normal. When things go wrong, you can get a bunch of different scenarios. So let's go. If you have hypothyroidism, low thyroid hormone, high TSH, the house is too cold and the thermostat is signaling the heater, the thyroid gland, to work harder by releasing more and more TSH. But maybe the heater is old and inefficient or running out of fuel. For example, iodine deficiency, malnutrition, or a damaged thyroid gland, is like what we would see if there was Hashimoto's disease. So balance can't be achieved. Thyroid hormone will be low, and the TSH keeps going up and up. The worst one of those I've seen lately was a TSH over 60, and the reference range for normal TSH tops out at about 4.5. So another scenario with low thyroid might work like this. The thermostat is just broken. So the pituitary gland, for example, that has a tumor in it, these are called adenomas or microadenomas, frequently cannot make TSH anymore, and it drops low. Just like the temperature in your house would drop if the thermostat stopped putting out a signal. In this case, the thyroid hormone levels will also be low because there's no signal to release thyroid hormone. The only way you would know this, aside from symptoms, is if you also have thyroid hormone levels tested, the free T3 and the free T4. So I know of more than one case where a patient was given radiation to destroy their thyroid gland because their specialist just checked the TSH, which was low, and didn't think to check the thyroid hormone levels. They just assumed they must be too high. Now, hyperthyroidism, high thyroid hormone, low TSH, Graves' disease, thyroid tumors. In that case, in the case of too much thyroid hormone, if the heat, the thyroid hormone, is coming from a source that the thermostat can't control. So your body's TSH release is controlled by its own sensor in the brain, by the amount of circulating thyroid hormone that gets into the brain. But sometimes thyroid hormone is coming from other sources that the TSH thermostat does not control, which will make things more complicated. So this is what happens when you have high thyroid hormone levels that can happen for several reasons. So imagine your house is heating up, not because the thermostat turned the heater on, but because there's a fire in the walls. This is a bit like what's happening in autoimmune thyroid diseases like Graves' disease. The house is overheating, so the thermostat slows down, sending the heating signal. In the case of Graves' disease, the immune system is forcing excess thyroid hormone production in response to the antibodies in your blood, even when TSH is already low. The thermostat senses that high hormone level and says, whoa, we don't need any more warmth, so it stops sending TSH. The thyroid gland, in response to the immune attack, keeps releasing more and more thyroid hormone in an uncontrolled way, not because there's TSH there. So the TSH signaling is turned off by the high level of thyroid hormone, but the fire rages on and the house keeps getting hotter and hotter, even if we open the windows. This leads to negative side effects and lots of problems that we're going to talk about in a minute. The body can actually activate its own fire suppression system, in this case, reverse T3, which we're going to get to in a minute also, to try to mitigate the really dangerous effect of high levels of thyroid hormone, though it usually isn't enough. There is a similar scenario, but it's generally somewhat less severe if you have a certain kind of a thyroid tumor called a toxic adenoma, sometimes called a hot nodule. These are generally benign tumors, but they secrete thyroid hormone without TSH telling them to do so. So that, in a nutshell, is how your thyroid hormone feedback system works. However, we have to keep in mind that there are other more precise mechanisms in your body that control the activation and deactivation of thyroid hormone after they're not in the thyroid gland anymore. So what happens when TSH is too low? What does that actually mean when you have low TSH? Well, if you're not on thyroid medication, a low TSH can mean a few things. It can mean too much thyroid hormone or hypothyroidism from a thyroid tumor that is producing thyroid hormone with no TSH, or it could mean Graves' disease, or sometimes Hashimoto's disease, or acute inflammation of the thyroid gland. In other words, an overactive thyroid. However, it could actually mean just the opposite, which is a pituitary issue leaves you unable to produce TSH and results in hypothyroidism, low thyroid. So these conditions, once they're diagnosed, are fairly simple to treat by physicians who are experienced in hormone management, sometimes requiring surgeries, but more often requiring medication to modulate the release of thyroid hormone. So if you're taking thyroid medicine, a very suppressed low TSH generally means your body is getting most or even all of its thyroid hormone from the outside, not from your thyroid gland. And your natural thyroid production is essentially shut down. This is occasionally done on purpose, for example, in thyroid cancer, where we need to be able to use an outside source of thyroid hormone to stop thyroid cancer cells from growing. But if that's not the case and your TSH is below normal, or especially if it's reported as less than 0.02, that means the test can't even detect TSH anymore, which usually means you're taking way too much thyroid hormone. Now, let's talk about why this is a problem. What are the risks of suppressing TSH too much? Well, there are three main risks that come with over-suppressing TSH, and they can seriously impact your long-term health. And the first one, and the most dangerous one immediately to your system, is heart problems. So too much thyroid hormone speeds up your metabolism and puts stress on your cardiovascular system. At first, it might feel good. You have more energy, you're losing weight, your brain feels sharper. But over time, it can cause serious issues, including rapid and irregular heartbeats or atrial fibrillation. A widened pulse pressure. This means a big gap between the top and the bottom of your blood pressure numbers. That means your heart is working harder with each pulse. High blood pressure. Really, it can be dangerously high blood pressure. And then over time, your heart can actually change shape, which is called ventricular hypertrophy, because it's being pushed to work way too hard. And that is absolutely not something you want, because it can result in something called cardiomyopathy, and it can result in the high risk of heart failure. Risk number 2 is overstimulation of other parts of your metabolism, which can result in sweating, shaking, weight loss, muscle loss, high body temperature, sweating, mood problems with anxiety and irritability, and energy crashes, like blood sugar crashes. So when these symptoms are mild, people might be tempted to proceed because it can feel pretty good to be energetic and even a little hyper and start losing weight when you have felt the opposite of that for years and years. But it's actually not a great way to be long term, because if you ever slow down the intake of the too much thyroid hormone, then you're going to go right back to where you were before, and it might actually be worse. So that brings me to risk number 3, which is imbalanced thyroid hormones. So this is a direct risk. So TSH is just one piece of the puzzle, because your body has different flavors of thyroid hormone. T3, T4, and reverse T3 are the ones that we mainly concern ourselves with. Each of these has a different role, and they all need to be in the right balance. So normal TSH alone doesn't mean your thyroid function is optimal, and low TSH doesn't mean that either. So if your doctor's only checking your TSH and not looking at free T3, free T4, total and reverse T3, they are missing the bigger picture. So if you want more details about how this works, I'm going to refer you back, when we finish here, to episodes number 2, 8, and 10, where I talk a lot more about reverse T3 and the different kinds of hypothyroidism that can make that important. So let's go back to our heater analogy, because oversuppression of thyroid medication is a big problem in more ways than one. Imagine that we have an old and kind of inefficient heating system, and somebody brings a space heater into the house and cranks it up right by the thermostat. Remember, the thermostat that decides how much TSH to make is up in your brain. So too much thyroid medication, even transient levels of levothyroxine usually, cause the thermostat to say, oh, no need for more heat, and slow down the signaling, resulting in low TSH. But it can also trigger the accelerated breakdown of T3 in the rest of your body. So imagine, and this is a little bit of a stretch, but imagine that the thermostat also had automatic window controls in other rooms of the house. They were triggered by low TSH. And then we would see also the accelerated production of reverse T3, which is made in response to high levels of T4. Reverse T3 blocks the action of active thyroid hormone T3 once it's made. So we get less T3, and we also get blocking action. So the problem with that is the house was already a bit too cold to begin with because the heater was inefficient. Turning the thermostat down makes the rest of the house get even colder. The central heat and the thermostat can't tell that the rest of the house is still too cold and not getting enough thyroid hormone activity. This is what happens when you take too much T4 thyroid hormone medication. And sometimes this can be hard to determine if you're only taking your thyroid hormone once a day. The thermostat is sensing plenty of heat or thyroid hormone parts of the day and turns down the sending of TSH. But here's the problem. The thermostat doesn't control that space heater. It can't shut it off. If you say, I'm still cold, let's try a higher dose, you actually end up getting the opposite of what you want. So the room with the thermostat gets hotter and hotter, leading to lower TSH. At the same time, you get less heat being dispersed into the house, and you get more reverse T3 being produced throughout the house. And when the T3 activity falls, the rest of your house is going to feel colder. Meanwhile, the high levels of T4 can do the damage and the side effects that we talked about above, and the low TSH will tell you that. So here's another scenario, and this one is the one that led me to choose this topic for today in the first place. So say somebody is taking high doses of liothyronine or active T3 and or a T2 containing supplement. And T2 is a breakdown product of T4 and T3. And say they're taking that instead of taking T4. So some clever internet thyroid fixers have figured out that if you take high levels of T3 and T2, you can give somebody higher energy and speed up their metabolism to accelerate weight loss, similar to the way that amphetamine would do the same thing. So they are recommending way more than normal physiology indicates is a healthy amount of T3 for your body. They also want to fly under the radar about the doses that they're giving. So they have convinced their followers that it's okay to take these really high doses of T3 by having people skip 1 or 2 doses. And remember, it wears off really fast. T3 wears off really fast. Skip 1 or 2 doses the day before going to get their lab test done so that they have the lab test done when the T3 levels have actually fallen back into their pre-medication levels, which gives you a much more normal range. But the TSH is still going to be responding to the high T3 that you had yesterday, so it'll be the tell. It takes longer for the TSH to start coming up. So it will generally be below the detectable limit, these people, even 24 hours or more after the last T3 dose, because it doesn't respond as fast as the T3 levels. So in our analogy, equate this to Texas summer heat, which I don't even remember right now because it's 15 degrees Fahrenheit right here today. But the thermostat detects the heat in the house, whether it came from the heater or it came from outside and seeped through the walls, because that's what happens in Texas. So because the thermostat is sensing the high T3, the heat turns off and the TSH signal turns off. And again, the thyroid gland is going to decrease or even stop making thyroid hormones, especially it's going to stop making T4. And well, it's going to stop making T3 too, but it's going to stop releasing T4. So your body won't have any significant amount of TSH because the outside T3 is signaling that there's too much heat. Due to no TSH, you have low T4, which is what reverse T3 is made from. So then if you have almost no reverse T3 to block the T3, then it just gets hotter and hotter in the house, even if you are able to open the windows. And within days after you stop taking high T3, your body is going to slam right back into hypothyroidism symptoms, sometimes much worse than it was in the first place, because the thermostat has gotten less sensitive than it was before because there was so much heat all the time. So, key takeaways. The TSH only controls the thyroid gland, the heater, not the activation or deactivation of thyroid hormone once it's out of the gland. Even if the heater is off because of low TSH, the house can still get too hot due to tumors or Graves' disease antibodies or from excess T4 or excess T3. And there are other situations where low TSH is related to abnormal pituitary or brain function and not elevated hormone levels, and the hormone levels will actually be low. So it's complicated. Too much T4 thyroid is like a poorly placed space heater telling the thermostat that it's hot even though the rest of the house is cold. So the TSH will attempt a shutdown if the thermostat is sensing that it's too hot by breaking down excess T4 and putting reverse T3 in to block T3 function. The final point is that the body really has no defense against taking too much T3 medication if there's little T4 being made because the TSH has gone too low and turned off the thyroid secretion of T4. So that brings us back to risk number 4, which is bone loss and osteoporosis. And you're thinking, okay, you're a thyroid doctor. What are you doing talking about bone loss? Well, this is directly related to low TSH, and big studies have been done that have shown this. And it's one that people don't talk about enough, and it generally isn't detected until it has progressed irreversibly, and that is bone loss and maybe fractures. So thyroid hormone definitely affects bone metabolism. Generally, when your TSH is too low, it's because thyroid hormone and thyroid hormone action are elevated, and the protein in your bones start breaking down faster than they rebuild. So this puts you at a much higher risk for osteoporosis and fractures, especially as you age. And this is really common with thyroid functions in general. There is a happy medium at which things are optimal. Too much thyroid hormone, not as good. Not enough thyroid hormone, not as good. There is definitely an optimal range for functioning of the thyroid hormone levels. But anyway, so higher risk for osteoporosis and fractures as you lose bone, as you get older, as you move into menopause. I personally take this very seriously because osteoporosis runs in my family, and I have seen firsthand what happens. I have seen firsthand what happens when bones become too fragile. Spine fractures, compression fractures, hip fractures, chronic pain, knee replacements, hip replacements, shoulder fractures. It is not something you want to mess around with. I mean, my mom, her back is bent over, bent forward. And it's not because she's overweight. It's not because she has too much cortisol in her body. She's just had a bunch of compression fractures, and her back is chronically painful. It's not something you want to mess around with. So the research is clear. People with long-term suppression of TSH are at significantly higher risk of osteoporosis and fractures. And once you lose bone, it is really hard to rebuild it. So how do you protect yourself? What can you do to manage your thyroid health and protect your bones? Well, the first one is make sure you're not over-suppressing your TSH. You need to work with a knowledgeable doctor who checks all the hormone levels, T3, T4, and reverse T3, not just TSH, and test them at the middle range, because if you're testing right after you take the thyroid hormone, you're getting the top of the range. If you're testing right after you skipped your thyroid hormone in the morning, you're getting a trough, and you might be missing the high thyroid levels that happen after you take your medicine. So a mid dose helps you see the average level and keeps them in or at least very near the normal ranges. Taking your thyroid twice a day is actually, in my opinion, also a better way to cut off those highs and lows so that you don't get suppression of thyroid hormone activity while you still have too much T4 circulating around. Thing number 2, get enough protein. Your bones need protein to maintain their strength. So I see a lot of this where people are skipping breakfast in the morning and then trying to eat a whole ton of protein later, and they're calling that intermittent fasting. Well, the truth of the matter is you can only metabolize about 30 grams of protein at a time, 20 to 30 grams. And your bones need protein to maintain their strength. So I encourage my patients to eat a high protein, savory breakfast that does not raise their blood sugar, but supplies plenty of protein for your activities throughout the day, including your exercise and bone building. Other nutrients that you need for bone health are magnesium, calcium, zinc, and other minerals. The next thing is do weight-bearing exercise. Walking is okay, but resistance training, especially heavy weightlifting, helps prevent bone loss. And this is true even in people who already have evidence of osteoporosis and who already have had fractures. Next thing, make sure your vitamin D levels are high enough. Many people are deficient, and it plays a critical role in bone health and your ability to absorb calcium and produce the protein matrix that keeps the calcium in your bones. So the middle of the normal range for vitamin D is actually 70, but most people hover right at the bottom of the normal range or are even deficient unless they are supplementing vitamin D, because it is very hard to get vitamin D in food unless you're taking cod liver oil, which, yuck. Also, consider menopausal hormone therapy if it's appropriate, even if you don't have hot flashes or other big symptoms of menopause. Estrogen really helps protect bone density in perimenopause and in the postmenopausal years. The bottom line is taking more thyroid hormone than your body needs or ignoring hyperthyroidism is not a good long-term strategy, even though it may feel good for a while. It puts your heart and your bones at risk, can leave you dependent on thyroid medication for life if it causes atrophy of your thyroid gland. If you're working with a provider who recommends keeping your TSH completely suppressed, it is time to ask some serious questions. All right, that's it for today. I hope that this episode has helped clear up some of the confusion around TSH and why it's not a good thing to suppress it too much. But I know there's a lot more to cover. That is why I'm going to host a live Q&A session on this topic. If you have questions about TSH, thyroid medication, bone health, or anything else related to your thyroid, join me live on Monday, March the 10th. I'm going to answer questions on a call and give you the science-backed answers that you deserved. We're going to do it at 12:30 p.m. Central Time, so hopefully that's during your lunch hour on Monday, March the 10th. So this is going to happen online on the new Good Self platform, a private ad-free app that connects you with physicians and other experts who are passionate about health and wellness. So why Good Self and not other apps? 1, no ads, just meaningful content and conversations. 2, direct access to expert health education and a like-minded community of doctors and other professionals who take care of people's health. It even has a private space to connect, learn, and grow. And you can sign up for a free Good Self account at www.goodself.com or in your mobile app store. And to get on my topics notification list, because I'm going to be doing these talks every week, these Q&A sessions. If you want to get on my topics notification list or for other up-to-the-minute hormone news or information about programs that I'm going to do, go to www.danagibbsmd.com/newsletter to sign up for my usually weekly, non-lame, non-promo type emails. So I'm going to be doing these Q&As live most Tuesdays at 12:30 Central Time on topics related to thyroid and hormone health. So this weekly Q&A and the accompanying private group that I'm starting in the Good Self app is your space to explore the integrative approach to thyroid and hormone health where science meets a holistic perspective. In that group, in that set of Q&As, we will dive into topics like balancing hormones and stress to support optimal thyroid function, nutrition and lifestyle changes for lasting energy and vitality, and cutting-edge medical insights blended with practical everyday strategies. All right, guys, thanks for listening to Beyond the Thyroid. Don't forget to subscribe, and I'll see you in the Q&A. Until next week, bye now. Thank you for listening to this episode of Beyond the Thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.